Hey, my name is Badass Benny. Welcome to my channel. If you're an ACE, AMAC, and sex human trafficking survivor, you're in the right place. And it won't cost you a penny to like and subscribe and to share worldwide. And please leave a comment down below on the video. Today we're going to talk about OCD, Obsessive Compulsive Disorder. It's highly researched and conceptualized, and yet it remains one of the most debilitating, widespread, and expensive disorders. During stressful life events can have an onset of OCD and are associated with a distinct clinical pattern like depression or anxiety. OCD and traumatic histories have a significant enough overlap that trauma should be a consideration when treating an individual with OCD. Many scholars dating back to 1903 are aware that trauma can and does impact the development of major psychiatric disorders. According to the Diagnostic Statistical Manual of Disorders, the 5th edition, my DSM, I wish I didn't give it away, about 1.1 to 1.8% of the world population experience a 12-month prevalence of OCD. Females experience slightly rates in adulthood, while males have slightly elevated rates in childhood. OCD is a neuropsychological disorder characterized by intrusive and uncontrollable obsessions and compulsions that cause significant distress to the individual. And that's APA 2013. And the obsession is thinking about it, and then the compulsion is doing it, taking action on it. OCD overlaps with PTSD. So OCD is a neurological or a neuropsychological disorder characterized by intrusive and uncontrollable obsessions, and that cause significant distress to the person. Obsessions are thoughts, urges, or images that the individuals experience are unwelcome and invasive. These obsessions cause discomfort to the individual with OCD by anxiety-provoking, guilt-inducing, and or disgust-laden. Depending on the nature of the obsession, the individual with OCD will actively try to avoid, subdue, or neutralize the obsession by engaging in avoidant behavior or compulsions. OCD is a highly individualized disorder. Obsessions may seem extremely illogical, counterintuitive, and disconnected, and yet themes of obsession have been found across the population. Everyone is different. In 2013, some doctors summarized the obsessional themes into categories. A, contamination. It's like, oh my God, don't wipe the table like that. You got to use this sponge, or you got to use this to clean that. Let's see. B, guilt and responsibility for harm to self or others. Uncertainty, taboo thoughts about sex, violence, and blasphemy. And E, the need for order and symmetry. With OCD, the compulsion that follows obsessional thoughts, images, or urges play the specific role of decreasing discomfort for the person, but do not appear to be logically connected to the obsession. For example, if you have a person with OCD experiences an obsessional thought, such as, my family and friends are going to get hurt, he or she may neutralize this obsession by feeling the compulsive need to turn the light switch on and off about 8 times before leaving the house or before you go to sleep. And when this compulsion reduces the house, when this compulsion reduces the anxiety of the person, feels the obsession of thought may then morph into the thought that my friend's family will get hurt if I don't turn the light switch on and off 8 times. I took my notes. The majority of clients recognize that their obsessions and compulsions are unreasonable. Nevertheless, there's a small portion of clients, about 4%, who have absent insight, delusional beliefs, and about their obsessions and compulsions. Trauma-related distress overlaps with PTSD. We just talked about that. Symptoms are clearly anxiety or fear orientated. At other times, the clinical picture includes depressive symptoms, anger, aggression, disassociation. PTSD and any combination of those symptoms may be present after the exposure to an aversive or distressing event like sexual assault. Conceptually, the overlap between OCD and trauma-related distress can be found in the way the person thinks and reacts to the intrusive thoughts inherent in the two situations. So, there are similarities between symptoms of obsessive compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, among people exposed to sexual trauma. Little is known about how these disorders related over time. What are you going to do to take care of yourself today?